Are you able to see my screen, right?
Yes, sir.
Thank you. One concept we can discuss PSI and HAC. Okay. So first I will show the question, then you will understand the concept. Check the 56th question. Up to 55 we discussed yesterday medical unlikely leads. 56 onwards we can start. Check the 56th question. A 75-year-old patient admitted for complex ventral hernia repair. While in the hospital, the patient slips and falls, suffering a left hip fracture. While the hip fracture is identified as part of the facility patient safety indicator, why or why not? So they are asking left hip fracture should be part of PSI or not. So first, what is the PSI we can discuss. Then how we need to identify the PSI we can discuss. So PSI means patient safety indicator. Patient safety indicators and HAC means hospital acquired conditions. This both was representing quality measurements, okay? Quality measurements of the hospitals. Quality measurements, okay? We need to use PSI and HAC indicators for the ICD-10 course in IPDRG. Use for ICD-10 in DRG. Okay. Were used for the ICD-10 course in inpatient DRG. Next, what is the PSI? Patient safety indicators were developed by the Agency of Healthcare Research and Quality, AHRQ, Agency for Healthcare Research and Quality, to provide mechanism for screening potential adverse events and complications that occur during hospitalization. What is the adverse events and complications? First tell me adverse events means, adverse effect means
Poison
poisoning,
medication.
Late effect,
late effect. Complications means
like
Severe.
poison,
now only said same poison. Complications like
previous
during
procedure,
the
now
hospitalization
get any
complications,
infection.
like post procedural complications or mechanical complications. Okay, post procedural complications or mechanical complications. Adverse events means due to the medication, like poisoning or adverse effects. These all are considered as adverse events, side events during the hospitalization. Tell me when the patient get complications in the hospital after admission in the hospital, when the patient get complications and why they get the complications. If you go to any hospital after the treatment, if you get the complication, they treated properly or not. You admitted in one hospital for the treatment of respiratory failure. During the treatment of respiratory failure, you will get some adverse events. Okay, so they done proper treatment.
No.
No, right? Suppose you admitted for the surgery. Suppose if the patient admitted for surgery, after the surgery, due to surgery, they find some complication, post procedural complication. Okay, post procedural complications was developed. So it was part of hospital misleading or hospital not treating properly, correct?
Yes, sir.
If they treated properly, the patient will not get any disease, right?
Yes.
Yes. If they done any treatment, after the treatment, if they get any disease in the hospitalization, it should be considered of PSA. But not all the diagnosis, they given some list of the diagnosis. Okay. Why we are looking for this PSA? No? For quality purpose and potential of the hospitalization. They have proper facilities, availability of the physicians and equipment. For this all measurement, they will calculate the PSI score. It was a administrative data. PSI used for the administrative data. Primarily diagnosis and procedure code to identify potential quality issues, allowing hospitals to target improvement efforts and enabling comparisons across facilities. Okay, they will check for the improvement of hospital efforts. In particular hospital, if they are getting mostly complications after the treatment, they consider that hospital was not treating properly and they will give the guidelines for that particular hospitals. They given the list of the diagnosis for PSI, guys. Okay, you will get in the domain 4. These are the patient safety indicators. No need to remember the value, just remember the condition names. Okay, like post-operative respiratory failure, post-operative sepsis, pressure ulcer rate, which means if they admitted with one pressure ulcer after during the treatment, the ulcer rate was pressure ulcer stage was increased. That also part of PSA. This also part of PSA. Hospital fall with hip fracture also part of PSA. PSI and HAC conditions we must give as secondary diagnosis only because these are not reason for the related diagnosis. These conditions must be developed in the hospital. So it should not be a part of principal diagnosis. So always should be secondary diagnosis. Should be SDX. These are. Now tell me, hospital fall with hip fracture was part of PSA or not?
Yes.
Yes.
Yes. It was part of hospital fall with hip fracture. Only hospital fall with hip fracture we have PSA. Not normal hip fracture. After admission in the hospital, if they fall and develop hip fracture, it should be part of PSA during the hospitalization. Okay. So yes, hip fracture should be part of PSA and it should be considered as secondary diagnosis, not principal diagnosis. Because here they admitted for the ventral hernia repair. So ventral hernia should be the PDX. Exam point of view, what are the questions you will get from the PSA? No? Post-operative respiratory failure and post-operative sepsis related. Note down these two conditions. Post-operative sepsis. In these two conditions related, you will get the question. They will give question like, which of the following diagnosis should be considered as PSA? They will give some options. In that, we need to find exact PSA related condition. They will give question like, which of the following is a part of PSA? Clear? Which of the diagnosis should be part of PSA? They will give the question. Next question. HAC related, hospital acquired condition. Same, Hospital acquired condition also we have the list of the diagnosis. Okay. These conditions also must be developed in the hospital. Here they given the list of the diagnosis. In this list, any one diagnosis developed in the hospital, it should be considered part of HSC. So stage 3 and stage 4 pressure ulcer should be part of HSC. Stage 3 and stage 4 pressure ulcers. HSC related, remember, stage 3 and stage 4 pressure ulcer. Some diagnosis comes under PSI and HSC both. At that time, both indicators we need to assign. So this question how you will get now? HSC related. You will get question like this, guys. Which of the following is found in the hospital acquired condition list? They will give some diagnosis. Okay, which of the following found in the hospital acquired condition list? They will give some diagnosis list. In this, we need to find hospital acquired condition list. The hospital acquired condition list found stage 4 pressure
Stage
ulcer.
4 pressure ulcer.
Stage 4 pressure ulcer should be the HSC condition. Either stage 3 or stage 4 you will get in the exam. Okay. One question you will get from PSI, one question from the HSC. Got it? Simple. They will give some diagnosis names. Which of the following is a part of PSI or HSC? They will ask. We have the list of the PSI and HSC diagnosis in the regulatory complaints domain for dark scanner. Okay, regulatory complaints dark scanner we have domain 4 related. Next question. Patient has shortness of breath, chest pain. X-ray chest shows normal, but potassium levels was elevated. For which condition you can raise the query? Elevated potassium levels means elevated means increase.
Hyperkalemia.
Increase.
Elevated means increase. Potassium means kalemia. Okay, hyperkalemia.
Hyperkalemia.
Hyperkalemia. Next, use of encoder software. Encoder was the coding software. It will use to lead the medical codes for billing purpose. Okay, it was a coding software. Just we need to lead the medical codes, either ICD, CPT, or PCS. How we are using the book? Same, we can use the encoder and we can lead the medical codes for billing purpose. Okay, medical record document converts into codes for billing. It should be the encoder software. Next, the rule which restricts entity without disclosing patient rules details. Okay, the rule which restricts entity without disclosing the patient rules. Privacy rule. Okay, privacy rule. To this concept. Are we going to these concepts, guys? Have we read it? No. Privacy rule. The privacy rule establishes national standard for protecting individually identifiable health information. Okay, also known as protected health information. Individual person health information will protected by the privacy rule. Privacy means security. So here, which rule restricts to disclose the patient details? Now, privacy rule will restrict to disclose the patient details. Based on privacy rule, we should not disclose the patient details anyway. Individual identifiable health information we need to protect. So the rule which restricts to disclose the entity of patient details, na privacy rule. Next, MSDRG values updated every year, which month? So while we are getting the ICD updates October month every year, at that time DRG values also they will update. Okay, October month, they will update the DRG values. You will get options like October, March, April, September, January, like that. We need to select October option. Patient come with shortness of breath, wheezing. After treatment, provider noted patient discharged within 24 hours. What kind of visit? If the patient discharged within 24 hours, it should be what type of visit?
Outpatient.
Outpatient.
Outpatient. Who stays more than 24 hours, it should be considered as inpatient.
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 Next. In report, pediatrician mentioned baby is premature, 36 weeks. But in mother record, they documented 38 weeks of delivery. In the baby record, documented 38 weeks of gestation, the baby born. And mother record documented mother was delivered at 38 weeks of gestation. So what is the exact weeks of delivery? We don't know. 36 weeks means it should be preterm, premature baby. 38 means normal delivery. So we don't know whether it should be 36 or 38. So it should be baby record. For whom we need to raise the query, obstetrician or pediatrician?
Pediatrician.
So for baby record, we need to confirm with baby. Clear? So you will get options like raise query to the pediatrician, raise the query to obstetrician, code as per the 36 weeks of gestation, code as per the 38 weeks of gestation options. Okay. So plan for the query for pediatrician. Patient coming with one diagnosis, provider states POA indicator cannot be determined by myself. If the provider unable to determine the POA status, what indicator we need to use?
W.
Provider
W
unable to
indicator.
determine, it should be considered as W. W. Patient come with fever, leukocytosis, WBC 15,000. Urine culture shows positive. Patient final diagnosis mentioned urinary tract infection. What is the POA for urinary tract infection? Here, patient coming with symptoms. After that, they find the established diagnosis. Symptoms related established diagnosis, if they find, what indicator we need to assign? Why?
Y indicator.
Why? Condition clearly present on admission, but diagnosed during the admission. Okay. Condition clearly present before admission, but it was diagnosed during the admission. So we need to assign Y indicator. Next 65 question check. The given decompensated CHF, respiratory failure unspecified, and COPD exacerbation. Then past medical history, leave it. DAM type 2 hypertension, CV and all. Based on this, what is the query opportunity here they asking? We don't have type of respiratory failure, so we need to raise the query for acuity or specificity of respiratory failure. For respiratory failure type, we need to raise the query. Next check. Patient admitted with calculus of gallbladder and cholecystitis. Patient done for cholecystectomy. How we will code the scenario? When the patient have calculus of gallbladder and cholecystectomy, calculus of gallbladder and cholecystitis, we have a combination code. Okay, calculus of gallbladder means cholelithiasis. Cholelithiasis with cholecystitis and cholelithiasis with acute cholecystitis, we have a combination code. If they're not mentioned cholecystitis acute or chronic, we need to consider as chronic cholecystitis. If they mentioned acute, go with acute. Otherwise, default chronic cholecystitis. So how you will code the scenario means we need to code calculus of gallbladder with chronic cholecystitis. Okay, not other cystitis or acute cholecystitis. We need to go with chronic cholecystitis. Unspecified cholecystitis, chronic cholecystitis. Okay, check these questions. Any doubt, ask me, I will help. Up to 66, check.
సిక్స్టీ సెకండ్ క్వశ్చన్లో పీడియాట్రిషియన్కి క్వెరీ అనే ఆన్సర్ ఉంది కదా సార్.
Yes, yes.
సార్ దాంట్లో అది రిపోర్ట్ బేబీది రికార్డా ఆర్ మదర్ రికార్డా అని క్వశ్చన్లో మెన్షన్ చేస్తారా సార్?
In report, pediatrician mentioned baby is premature 36. ఇక్కడ బేబీకి చెప్తున్నాడు కాబట్టి బేబీ రికార్డే కదండి. పీడియాట్రిషియన్ ఎవరి రికార్డు చూస్తాడు? Pediatrician reported కదా. In report, pediatrician mentioned 36. So, pediatrician means baby record. Correct?
ఎస్ సార్.
సార్ ఇంకో ఫిజిషియన్ నేమ్ కూడా చెప్పారు కదా సార్.
Obstetrician అండి. మదర్ రికార్డ్, మదర్స్. ఓకే,
మదర్స్. ఓకే,
obstetrician means for mother delivery case. So they are asking like we will confirm with pediatrician or obstetrician. In baby record, so we need to ask for obstetrician. Mother means pediatrician. Baby record pediatrician. Mother means obstetrician.
సార్ ఇప్పుడు క్వశ్చన్స్ ఇఫ్ ద రిపోర్టెడ్ ఫర్ మదర్ రికార్డ్స్ అని అంటే అప్పుడు మనం ఒబెసిటీ అని ఇవ్వాలి కదా సార్, అంతేనా?
మదర్ రికార్డుకి బేబీ గురించి అడగరండి. మదర్ రికార్డ్ లో మదర్ గురించి అడుగుతారు, బేబీ గురించి ఎందుకు అడుగుతారు?
ఓకే,
బేబీకి బేబీ రికార్డ్ సపరేట్ ఉంటుంది, మదర్కి మదర్ రికార్డ్ సపరేట్ ఉంటుంది. మదర్కి ఏదైనా కాంప్లికేషన్ వస్తే మదర్ రికార్డులో అడుగుతారు. See 67 onwards. HIPAA and high-tech given on which title? So these are default question, guys. HIPAA and high-tech comes under title 2. Okay, you will get direct question. HIPAA and high-tech comes under which title? And title 2 should be the answer. Remember. Then, patient coming with the established diagnosis and symptom like fever. Fever and sepsis, vital signs and antibiotic IV fluids also given. What should be code or assigned? What we need to code here? We need to code sepsis. When the established diagnosis found, no need to raise the query, no need to code symptoms, condition related symptoms. Clear? Next, MCC condition related. Patient admitted with gastric ulcer with bleeding. During the stay, patient complained about abdominal pain. Under investigation, they found appendicitis with peritonitis without obstruction. What is the MCC condition in this case? So MCC condition should be gastric ulcer with bleeding. So lead the diagnosis in index if you don't know the code. If you already know the code, directly go for the tabular list. K25 series something you will get, gastric ulcer with bleeding. If you want, you can check. K25 series check. K25 4 something. See?
250, sir.
K250, what is the code?
Acute gastric ulcer with hemorrhage.
ఇక్కడ అక్యూట్ చెప్తలేడు కదండి, సో క్రోనిక్ or unspecified you will get same. Okay, acute means acute. If they documented, we need to go with acute.
254, sir.
K254. Next, pregnancy case study, a question. Okay, K254 MCC will get.
In this question, appendicitis with peritonitis also act MCC, na?
It should be CC, I think. Check without
No, sir.
obstruction.
MCC.
MCC. What?
Peritonitis is MCC.
MCC. Okay, 2 MCC you don't get, might be 1 only will get there. Okay, I think it should be CC. What is the code?
No, if we are coding just peritonitis, then it is MCC. With appendicitis, I don't think it will turn as MCC.
So it should be CC. I checked actually, but I didn't remember the code. K35 series something you will get. I already checked sometime. So go and check. You don't get 2 MCC conditions anyway. Okay. K35 something series will
K35.30.
30. We have the code combination, I think.
It's access CC.
Appendicitis with peritonitis without perforation or abscess, CC. Clear?
Yeah.
Thank you. Next question, pregnancy based question. So here patient was pregnant, admitted with history of obesity and gestational diabetes. Okay, and they ordered ultrasound. After ordering ultrasound, they found oligohydramnios in the ultrasound. Then they admitted for labor. Labor means delivery. Prolonged stage of labor due to malpresentation. Labor was delayed due to malpresentation. So they planned for the C-section. What is the principal diagnosis here? They ask. So what is the reason was admission in the hospital? Oligohydramnios, right? After found in the ultrasound, then they plan for the labor. Oligohydramnios they found in the ultrasound, then they plan for the labor. They admitted for the labor. So reason of the admission should be oligohydramnios. They not mentioned anywhere weeks of gestation. Then what we need to go with? Unspecified weeks we need to take, because you are not getting query option here, guys. All the 4 options will get codes. Okay, so here you will get unspecified trimester. Lead the code under pregnancy complication oligohydramnios. What you will get? Tell me. Under pregnancy oligohydramnios. You will get O41.0, right?
Yes, sir.
0, 0.
O41.0 you get. So you can go for that particular code in the tabular list. O41 0, you can go for the tabulary.
O4100 is unspecified trimester, sir.
Beside, they given sixth like that, you are getting seventh character, na? O41 0 beside. Yes or no, guys?
0 for unspecified trimester.
You are getting up to O4100. Beside of the O4100, they given seventh character required, correct?
Yes, sir.
So sixth character, there is no sixth character. If there is no character, what we need to do?
Place,
Placeholder.
Placeholder
place
X.
of upper. Yes, sir. Yes.
Placeholder we need to
Placeholder.
place. Sixth should be placeholder X. Then seventh character should be fetus identification. Here we need to take number of fetus. If they not specified or unspecified, 0. If they have multiple fetus like 1, 2, 2 means they are treating fetus 1 or fetus 2. Based on that, you will get. Okay. So if they done fetus 2, 2, fetus 1, 1. If there is not specified any fetus, 0, X, 0, 0, 4, 1, 00, X, 0. Suppose if they mentioned weeks of gestation, based on that, you will get the trimester code. Okay. 1 to 14, 14 to 28, 28 to delta. Based on weeks of gestation, you will get the trimester. Able to find the oligohydramnosis code?
Yes, sir.
Yes.
Next code. What is the vaccination code for the pneumococcal conjugate vaccine? We discussed the vaccination codes, right? So while we are coding the vaccination, first we need to check single vaccine or multiple vaccine. Default, we need to give the immunization code 90471. Immunization administration. Then type of vaccine code. Under vaccination, pneumococcal conjugate, if you lead, you will get 90670 for 13 variant. If they not mention any valent, we need to go with minimum valent. Okay, you will get 13, 20, 21 valent like that. If they not given any valent, you need to go with minimum valent 13. So first vaccine immunization 90471, then pneumococcal conjugate vaccine 90670. If we need, they given any ICD code for vaccination, default we need to code immunization status JET23 ICD code. JET23 ICD code we need to give. Immunization status code. Okay, va? So lead the under vaccination pneumococcal conjugate check.
సార్ సిపిటీలోనా సార్?
CPT. under vaccination pneumococcal check in CPT index.
Eight zero six seven zero.
90670 they given, correct?
Yes, sir.
Thank you, guys. Next question. Next question. As per the HIPAA retention, how many years we need to must protect the documentation? How many years document we must maintain? Whichever earlier, at least 6 years document we need to must maintain. Okay, we need to protect at least whichever earlier 6 years data. 6 years earlier data we must document and we must maintain. Okay, so 6 years data we must protect as per the HIPAA retention, whichever earlier, at least 6 years we need to maintain. 6 to 25 years. Okay, 6 years minimum, 25 years, up to 25 years you need to maintain. Minimum 6 years. Okay, whichever is later, 6 years we need to maintain at least. Next, renal failure documents one position and renal insufficiency document other position. What is the coding professional will do? Conflict between the two providers.
Query for the attendance position.
Error.
Query for the attending physician for review. Conflict between two providers. Next concept, high tech. We discussed, right? High tech required to provider implementation of EHR. What does high tech required to provide implementation of EHR? The meaningful use of EHR. The meaningful use for the providers required to implementation of EHR. The meaningful use of EHR. High tech was part of which legislative organization? High tech also a part of HIPAA. It was protect for the, it will provide the guidelines for providers to maintain EHR documents and adapt to the EHR system. Next, when the patient have neoplasm and they admitted for the therapy, okay, if the patient coming with neoplasm, in the current visit they admitted for the chemotherapy or radiation therapy or immunotherapy, what should be the sequence first? Reason of the admission should be therapy means therapy should be always sequence first. Encounter for radiation therapy, encounter for chemotherapy, or encounter for immunotherapy. If the patient have neoplasm and they admitted for the therapy, encounter for the therapy should be sequence first. Okay, here patient have lung cancer and metastatic bone cancer. Now present for radiation therapy. In this scenario, what will be the PDX? Encounter for the radiation therapy, then lung cancer, then bone cancer. Encounter for the therapy should be sequence first. Z51 series you will get encounter codes. While we are discussing at neoplasms, you have idea, right? Neoplasm guidelines. So if the patient admitted for reason of admission should be therapy, therapy should be always sequence first. Next question, by heart the DRG value, CABG and develop post-operative respiratory failure, CABG with MCC. Okay, 233. CABG with MCC 233. Cardiac procedure with MCC will get 233. Then, what is the use of RX norm? RX means prescription or drugs, correct?
Prescription.
Prescription of drugs, correct? RX means prescription of drugs. RX norm means it will provide the normalized or standardized name for the clinical drugs. RX norm will provide the standardized or clinical names for the drugs. Okay, RX norm is used to provide standardized names and unique identifier for clinical drugs. Standardized names it will provide it for the drugs. Patient having shortness of breath, wheezing, nausea, and moderate persistent asthma. How we will code the scenario?
Only asthma. Persistent
Only
asthma. Moderate
persistent
persistent
asthma we need to code. Only persistent asthma enough because SOB, wheezing, nausea should be symptoms.
symptoms.
Okay, code only persistent asthma. I didn't get you, bro. Persistent asthma enough. While you are coding asthma, check with exacerbation or without exacerbation. Next also sequencing related. Here patient coming with chest pain and tachycardia, urinary tract infection, proximal atrial fibrillation. Patient is on Eliquis. What is the PDX? Proximal atrial fibrillation should be the PDX because chest pain and tachycardia was the symptom of proximal atrial fibrillation. Chest pain and tachycardia should be symptoms of proximal atrial fibrillation. So proximal AFib should be the principal diagnosis. Okay. Then urinary tract infection, then long term is of Eliquis, anticoagulant.
anticoagulants.
Anticoagulant. Next, supervisor asking another patient for CHF clarification, but patient already left the hospital and discharged to home. What type of query it should be?
Retrospective. Retrospective.
After discharge, it should be
Retrospective.
retrospective. Retrospective. Next, patient have renal mass. Surgeon done nephrectomy procedure. Pathologist documented renal cell carcinoma, but final assessment documented again renal mass. Will be the query need or not? So documented renal mass. Pathologist states it was adenocarcinoma. Surgeon done nephrectomy, removal of the kidney. So how we need to code whether mass or carcinoma? We don't know. So we need to raise the query for attending people to confirm the diagnosis. Conflict between the two providers, whether it was mass or carcinoma. Next question, you will get two PCS procedures and they will ask the sequence. Okay, here they are performing esophagus biopsy with esophagogastrodiadonoscopy and debridement on left lower leg subcutaneous level. Please code the sequence. Patient coming with hematemesis and found swelling in left lower leg. Patient documented gastritis and cellulitis. Patient performed esophagus biopsy with esophagogastrodiadonoscopy and debridement on left lower leg subcutaneous level. Please code the sequence. While they performing the multiple procedures, we need to look which procedure have highest revenue. Compared to the biopsy, debridement have highest revenue, so we code first debridement, then biopsy procedure. What is the root operations for biopsy and debridement? Excision.
Or debridement
Excision
open
should-
and percutaneous.
I didn't get you.
So excision.
Which one?
Upper maxilla, sir.
Debridement was open.
Huh.
Yes.
Then biopsy should be esophagoduodenoscopy.
Then via natural or artificial opening endoscopic.
Correct. Biopsy. And biopsy, so qualifier also will get diagnostic. Under excision, okay, how we need to lead two procedures, I will tell. They will give two options, same course, guys. One option they will give the biopsy procedure first. In one option they will give the debridement option first. So we need to look whether it was start with debridement code or biopsy code. Which option start with debridement? That should be the answer. First, debridement, how we need to lead. Under excision, check the level where it should be. Subcutaneous, right? Depth.
Yes, subcutaneous. Correct.
Under subcutaneous lower leg. Do not check under muscle, tendon or skin, because in all the locations you will get all the depth, you will get the lower leg body part. Then open approach, no device, no qualify. Then biopsy, how to lead. Under excision, esophagus. Then EGD, via natural or artificial opening endoscopy. Yeah. Excision, esophagus via natural or artificial opening endoscopy. This is the leading. So try to lead if you want to lead. Leaded, guys.
Yes.
ODB 58, sir.
Yeah, ODB 58, no device. Qualifier should be diagnostic because it should be biopsy. For all biopsy procedures,
Sir, sequencing ki
OJ.
guideline.
sequencing we need to get based on the revenue value. Okay. So compared to biopsy, debridement have highest revenue.
Okay.
Next, transmission of patient health information procedure for billing purpose. Transmission of patient health information for billing purpose is which type of violation? It should be the accountability violation. Transmission of health information for billing purpose, it should be considered as accountability violation. Next question, direct ICD procedures, ICD diagnosis, morbid obesity and BMI. You will get directly morbid obesity code and BMI code. E6601 and BMI 60 Z6844. Directly we'll get the codes E6601 and Z6844. Next, case mix index based on which related group? Case mix index related to the MSDRG calculation group. Okay, case mix index was used for the calculation of DRG value. It should be a formula. Okay, this case mix index is calculated by adding up the relative weights for every inpatient discharge, then they dividing the total by the number of discharges. The formula straightforward, but the input require understanding how diagnosis related group DRGs. Okay, CMS case mix index, total of DRG relative weights plus total of number of discharges. So CMI case mix index was related to the DRG group. Okay, this formula was related to DRGs. Case mix index was related to which group? No, DRG value related group. MS, DRG or DRG, same. MS means Medicare severity, diagnostic related group. Next question. Patient admitted with acute kidney injury. Incidentally, they found patient have hyponatremia and dehydration. Hemodialysis procedure done. Code the scenario. So here, what is the reason of admission?
PGI.
Acute kidney injury. So acute kidney injury should be the PDX, and they perform the hemodialysis. They not mention the time. So we need to go with less than 6 hours per day whenever they not mention the duration. Under hemodialysis, you will get 5A1D. If we lead the 5A1D, fifth character will get duration. Less than 6 hours per day, 6 to 18 hours per day, greater than 18 hours per day. We need to check. Here they not mention the duration, so default less than 6 hours per day, 5A1D 70Z. And acute kidney injury should be the principal diagnosis. Then hyponatremia and dehydration should be secondary diagnosis. Patient has finding suggestive of chronic obstructive pulmonary disease on chest X-ray. They documented the COPD and chest X-ray. Can we code from the X-ray report?
No.
No, right? We should not code directly from the X-ray report, no?
Yes.
Okay. We should not code directly from the X-ray report. The attending patient mentioned the X-ray finding in one progress note, but no medication, no treatment, or no further evaluation. So what the coding professional should do? Radiology note we should not code.
Query category.
So we need to raise the query to attending patient regarding COPD. Next, which year HIPAA became a law? Which year they are started the HIPAA Act? No, 1996 they started the HIPAA Act. 1996 they started the HIPAA Act. So guys, up to 94, whatever you have doubts, you can ask me, we can discuss.